Hello, everyone, and welcome to Dermapen World webinar. My name is Alona Gellerman, and today we have the pleasure to have with us three of the very top key opinion leaders in the aesthetic field. Dr. Per Hedén, from plastic surgeon from Sweden, that we will be speaking on integration of Dermapen in the plastic surgery. Dr. Gabriela Casabona, a dermatologist from Spain, that will be presenting on combining Dermapen with other non-surgical modalities. And Dr. Chino Bay, dermatologist from Miami, that will be presenting on DP Dermaceuticals, advanced integrated skincare. At the end of the presentations, we will open for Q&A. So I kindly ask you to post your questions, and we will try to do our best, although our time is limited. However, later we are planning to send and to post all the Q&As for everybody to see the questions and answer. Thank you very much. And now it's a great pleasure for me to invite my dear friend, Per, to present on integration of Dermapen in a plastic surgery. Please, Per.
Thank you very much, Alona. I will start off by speaking a little bit about I just have to find my presentation here. Are we on here? So I'm going to speak about integration of Dermapen into a plastic surgeons and dermatologist practice together with other modalities for treatment. And that is also another topic that I would like to cover with a few words because it's so up to date for us, and that is how to get your practice to survive and to get started after COVID-19. I just want to mention that in a few words, even though the majority of what I say today here is why dermatologists and plastic surgeons should include microneedling in their toolbox. Just my disclosure and conflict of interest. After 42 years of plastic surgery, I have relatively extensive conflict of interest, but what's relevant for this presentation is obviously that I have compensation for educations by Dermapen, but also research grants for my institution, Akademikliniken, from them. My background dates back 42 years in plastic surgery. As I mentioned, I'm an associate professor at the Karolinska Institute in Stockholm and founder of Akademikliniken in Sweden, which is now one of the largest plastic surgery facilities in Europe. I'm also a very early user of botulinum toxin and hyaluronic acid and written quite a lot on that. Now, Dermapen treatments have traditionally been done by skin therapists, but this presentation will underline why they're also an important tool for physicians.
Sorry, Per, to disturb, but we cannot see your slides.
Sorry. Thank you for telling me that, because I thought you saw it. So I'll go back here.
Thank you. Sorry.
Let's see. Here should be. Do you see it now? Hello.
Now, yes. Now, yes.
Okay. So what I said is that aesthetic physicians no longer have a very limited toolbox, but we have a larger toolbox for treatment of patients than ever before. And I believe that microneedling is one of the tools that you should have in a toolbox as being an aesthetic physician. The content for an in-depth workshop of microneedling obviously includes many, many different topics, but we will not have time to cover that today. So I will focus on why microneedling with the Dermapen, and then microneedling versus other treatment and in combination with other treatments. But first, a few words about COVID-19, which is a pandemic that greatly have affected aesthetic medicine practices. I don't think anybody is unaffected, even though we in Sweden living in a totally different world compared to many others where we've had our practices open, but with a great deal of restrictions. And I think that some of the experience that we have had during this time would be valuable for others to know. So the question for many of you is how you survive after this pandemic, and how do you get started again? Because it's very likely that COVID-19 will damage aesthetic procedure, but the demand for aesthetic procedure will probably surge after the pandemic when we get the step back. But it's also likely that patients and practitioners will be very careful in starting all over again because of all of the things that we've seen in the last couple of months. And non-surgical procedures such as microneedling could be part of a slow and careful start. Now, how do you carefully start your practice after COVID-19? Well, there are many, many things we should consider, and I will not have time to go through it, but obviously we should limit any treatments of patients that are high risk, such as very elderly patients, treating patients with high BMI, definitely not above 40. When it comes to surgery, we have limited to 30 actually. And no handshaking. I think what is more important than anything is what we have evidence-based medicine on, scientifically proven, and that is handshaking is something we should be very careful with. So a different way of greeting our patients and careful hand hygiene, and then social distancing, very, very important. So this is a topic that we will speak a lot on in the coming month, I think. Going over to microneedling. Why microneedling with Dermapen? Well, there are many, many reasons for it. It's definitely the golden standard. It's a low investment for physician and therapist, and many other reasons that you can see here, but due to the limited time for my presentation, I will not have time to go through it in detail. But it's very clear that it has many, many advantages. Now, facial aging is a gradual and slow process. We know that we lose fat, we get bone resorption, but we also lose elastin, collagen, and glucose aminoglycans, and that's what creates structural changes to our skin. And this results in very typical facial changes, and several of these can be reversed with Dermapen treatment. Due to the simplicity and the good results of microneedling, there has been a very rapid growth of different microneedling techniques, and there are many different microneedling techniques on the market today, but there's no doubt that Dermapen is the golden standard, a much more high-tech development of microneedling. But it's definitely a very popular procedure globally today. Now, one of the benefits of the Dermapen 4 technique, which is the latest development, is that we deliver substances into the skin. If we compare it to the left slide here, topical application, we can see that the product basically stays on the surface. There is very little penetration. Superficial injections such as skin boosting spreads the material into the dermis, but it's an uneven spread compared to the right here where you see usage of Dermapen to deliver the substance into the skin. And we can deliver a multitude of different things such as cosmeceuticals, PRP, fat grafting, steroids, superficial fillers, and botulinum toxin. Now, comparing microneedling versus other treatments, I think it's important to realize that for any plastic surgeon in the 1980s, you usually always thought about your scalpel. Personally, when I saw a patient, I always thought about where do I plunge my knife into the facial of this patient to help her. We didn't do much things without our scalpel. This is not sufficient anymore. In the mind of a plastic surgeon, during a consultation in the 21st century, there's so many different things we have to consider. We have to consider how to improve the skin structure with cosmeceuticals, different type of lasers. We also have to think about injectables, microneedling, and obviously also our scalpel. So compare the surgical procedures to the non-surgical procedures, we can say that surgery has the benefit of being long-lasting and sometimes even permanent. There are dramatic changes that we can achieve and less limited compared to non-surgical procedure. And it may be cost-effective long-term. Whereas non-surgical procedure has no or limited downtime. They're very reversible in most cases and a cheap short-term. No anesthesia, less apparent change, less risk for complication, and no revealing scars. And this is something that patients really appreciate. So there are many reasons why patients want to avoid surgery. First of all, there is a big fear for anesthesia, but also the concept of opening up everything, like here in a facelift or a forehead lift, that scares patients, no doubt. And there is also irreversible problems and complications, like this is an ablative laser peeling with the hypopigmentation, or a poorly performed facelift with visible scars and hair loss. The question when it comes to skin structural changes, because they happen, the structure of the skin changes over time. What is the best way to improve the structure of the skin? Surgery usually isn't considered for skin structural improvements. Facelifts in the 21st century much more about repositioning of descended tissue than skin stretching. So this is just how we reposition the face with the high SMOS elevation. And we can see that we really elevate our jowling and the mid-face by elevating the deep tissue. But it doesn't really usually change the structure of the skin so much, even if you can see skin structural improvement, as in this patient, when they have had acne scars and small rhytids in the skin. To improve the structure of the skin, we usually consider other things, and that may be skincare products, obviously including sunblocks to avoid progressive damage of the skin, bioactive cosmeceuticals, that's also something that Chino Bay is going to speak about later on today on how we can use these cosmeceuticals to improve skin structure, but also HA fillers injected, microneedling as the topic is today, dermabrasion, chemical peelings of different types, and also laser treatments and other energy-based devices. Fat transplant, microfat, nanofat, and so on, is also something that can improve skin structure. And also we know by reducing muscle activity, botulinum toxin injection can reduce skin structure. So why Dermapen, my topic here today? Why Dermapen by surgeons and dermatologists? Because it's a very ease-on and add-on easy add-on during other procedures. So you do a patient in general anesthesia, it's really simple to add with Dermapen. It can also be used more aggressively during surgery because the patient is under anesthesia if you believe you get better results with that. And it's cheap versus, for instance, lasers. It's less cumbersome and less risk for complications. If you use it during surgery, for instance, it could also be used as a follow-up with your skin therapist. You refer your patients to the skin therapist after, and that creates a long-term relation to your clinic. So don't think about microneedling as something only separate, even though it can be used instead of these procedures, but it can also be used before, during, and after both surgery, botulinum toxin, fillers, and laser treatment. So don't just think about this as a solitary thing of doing for your patients. And as I said, it's clear that microneedling can deliver products into the skin. The most obvious indication for combining of microneedling with other non-surgical procedures is the very established things we do with fillers and botulinum toxin. When I use it together with fillers and botulinum toxin, I usually start off with the filler here. The patient is very disturbed by her perioral situation. We inject in the long lip line, and I usually use a antegrade technique where I push the material in front of my needle to reduce pain. And then from having done the lip contour, I do vertical injection and then use it in the superficial dermis. This is then followed by dermabrasion. So I have a little bit of the benefit of the local anesthetics that it's in the fillers. And obviously you decide on what depth you're going to use. Here I use a little more deep treatment. It's not just the standard 4 passages. I use up to 10, perhaps even 20 passages. The depth obviously depends on which area. It takes a little bit longer. This is not the same type of lunchtime procedure. If you do a little deeper procedure, a little bit more bleeding, but it's not as aggressive as I would consider to do in surgery. And then followed by the dermapen treatment. I use my botulinum toxin and I use it in the corrugator. And then we put on a cover recovery cream. So the patient basically should be able to go back to her office or work directly. It has a little bit of a color tint, so you don't see the redness in the skin, and the redness will disappear in a couple of days. So this is the patient after the treatment, and the patient before and directly after the treatment. Subtle change, but for the patient, very rewarding. And the follow-up before and directly after the treatment, where you can see that her vertical rhytid has disappeared, and obviously we get the long-term effect of the microneedling by combining that. That's a month after on the far right, or a couple of months after. But also remember the potential of combining it with different surgical techniques during surgical intervention. And this patient has a ptosis, and for that reason, we will correct her upper lid with a ptosis correction. We will do intradermal micro fat grafting to the face. We use perioral micro grafting and micro fat grafting with a cannula, and fractional CO2 laser in the lower lids to avoid hypopigmentation, and then full face microneedling. With the delivery of adipose-derived regenerative cells into the skin with the microneedling. So it's a combination of doing all of those things. And this is the patient before, no, it's 6 months postoperatively, sorry, overview and a close-up of the same patient. And a still picture before and after, where she has a more open upper eyelid. But if we look carefully at her lower lids, where we combine the fractional laser with her dermapen, we can see a very good structural improvement in her skin. And actually, by avoiding the hypopigmentation that we see with the ablative CO2 lasers, so a much more improved structure of her skin. But it's also a simple thing to use during a facelift. So this is, once again, the high SMOS elevation. And it's important, I think, when we do surgical intervention, is that we use it after our surgery. So because it's not a completely sterile environment when you have your dermapen. Obviously, you cover it with this rubber, and then you have a sterile product that you use. When it comes to the post-op healing times, it depends on how aggressive you are. There are patients who you should not treat because they're too elderly. This patient is extremely disturbed by her situation in her neck, and she's too old. She's well above 80 and not completely healthy. So we have decided not to do a facelift on her, which would have been the indication. In a younger patient, it's a direct excision. And then we do fat grafting periorally and in the face. And then we do microdermabrasion, and we do it very aggressively. So this is directly after the treatment. This is 4 days postoperatively and 14 days postoperatively, also combining with a little bit of dermabrasion. Her situation before and 5 months postoperatively, with a great improvement in her perioral rhytids and her perioral situation, and her oblique view, which was mostly important for this patient, with her neck improvement with a simple direct excision. This is the patient you saw before, who had her lower lid treated. And she came back and wanted more micro needling and also a lip lift and a lateral brow lift. So it's a combination of micro fat grafting with aggressive micro needling periorally. And then doing that, we also massage the material into the skin. And this is her directly after the procedure and 1 week post-operatively. You can see the redness still a little bit on the lip with the relatively aggressive microneedling. But also think about the possibility of using this when you do other procedures. So this patient is doing a liposuction, and then we use it together, taking some of the fat that we've done from the liposuction and do microneedling of the full face to improve her skin structure. We also use microfat here together with the microneedling, and then we massage the fat into those small channels that are still open directly after your microneedling. But remember that if you wait too long, those small channels will close. And this is her skin structural improvement early on after 10 days, where there's still a little bit of discoloration in her skin. And think about out of the box, don't just use it during your facial aesthetic procedure, but also in other type of procedures, like here, body contouring procedure, and then microdermabrasion, micro needling of the face. And as I said, what we always use with the fat is to massage it into the skin. Think about it also after surgical procedure. This patient has gone through the perioral rejuvenation with forehead mid-face lifting, but is still disturbed a little bit by his right id in his periorbit. So we use microfat grafting together with fillers, hyaluronic acid fillers, and we do quite aggressive fillers, and then also botulinum toxin injections. And the patient before and after the surgical procedures, and then after the 2 stages that were done with these no surgical procedures 2 weeks after the treatment. You can also think about delivering botulinum toxin into the skin together with the Hylaglade solution. You mix it with botulinum toxin, and then we use microneedling. The depth of this microneedling does not really completely remove the muscle activity. It just improves the skin structure and adds to helping the skin structural improvement by delivering botulinum toxin in this way. And the patient afterwards still have muscle activity, but then improve skin structure of his treated area. This is 18 months after the surgical procedure and those 2 treatments that he has gone through. A close-up of those areas. Now, even if we have several good results and a number of publications on the effects of microneedling with addition of PRP or fat graft, it needs more scientific documentation. And for that reason, we are planning a split phase study with 4 different cohorts that we just initiate at Akademikliniken in Stockholm. The first cohort is a standard regime on half of the face. We had some problems to get the quick approval from the ethical committee, but it's now approved. The other cohort is one side more aggressive deep treatment and one side standard treatments. The third group is bilateral treatment, but additional adipose-derived regenerative cells on only one side. And this fourth group is standard treatment on one area before a facelift, and then histological examination and comparison of the skin versus the non-treated skin on the other side. So in conclusions, Dermapen has many indications together with other treatment, but also alone, both non-surgical and surgical. Dermapen should be in the toolbox for most aesthetic physicians. And the treatment has high patient acceptance, relatively pain-free, and a mild recovery. This is my own directly before and after my own treatment. And during the treatments, this is my third treatment. Finally, just one word about our Beauty Through Science meeting in Stockholm, which is held not this year, unfortunately, because of COVID-19. So instead, please come to BTS June 16 to 19, 2021, when we hope to put on an even better program. Go to btsstockholm.com and look at the program as it evolves, and hope to see many of you there. Thank you very much for your attention.
Thank you very, very much, Per, for such a fantastic, as always, presentation. I think it was really very interesting, and there are many questions out there for you. And for sure, you know, I'm one of the most advocated for BTS meeting, and I think that it will be a wonderful meeting next year, and I invite all of you, if you didn't have the chance to participate, to come and to see, you will never miss it. And now I'm great honor to have Dr. Gabriela Casabona from Spain to present on combining dermapen with other non-surgical modalities. Please, Gabby.
Hi. Well, correctly, I'm not from Spain, I'm from Brazil, but
yes.
Okay, I live in Spain now. So can you see my screen? You can see my screen? Great.
Yes.
Okay. So I'm a dermatologist since 2002. So then you can guess how old I am. And I started using microneedling in the year 2006. I was very curious because I had so many patients coming from Europe and doing like a secret treatment with injections on the face. And I wanted to know what it was. At the time, it was like a mesotherapy that they used to do in France. But to have my patient injecting in the whole face, a lot of bruisings, I thought it was not very nice. So I started using drug delivery in the year 2006 with what we had, which was rollers. And then in the year 2011, I went to EADV in Lisbon, and I was the first Brazilian to have a dermapen first generation. And when I got the dermapen to Brazil, I was so happy because the thing is, you can customize your treatment with one tip. And for me, it was like mind blowing because the roller, you had to have like 3 rollers to customize a face. So it was really nice. So then, of course, other devices came to the market. So as the ones with the stamping, the RF, with microneedling with RF, I tried other devices, but still my preferred one is the dermapen. Now I have the dermapen 4, which is very nice because it's wireless. And other than being wireless, it's also very, So other than being wireless, it's also easy to put on a sterile glove and use it, and it's a very clean procedure. So what is dermapen for me? So for me, when we look at a procedure, we have to look outside the box. We are doctors, we are thinkers, we are the philosophers of our field. So we have to think outside the box. So what is dermapen? Dermapen is not only a treatment how it was marketed in the beginning, that is only to bring collagen and elastin, but it's also a safe, cost-effective way, which, okay, but also is a very effective drug delivery, and it's been proven. We're going to discuss the science behind it. And also for me, it's a healing modulator. And for me, the 2 last ones, and I hope per study can show more for us and what is the significance statistically. And but I think those 2 are going to be the future. So why dermapen is different than other things that I've used, other devices that do microneedling? So I can customize different depth. It's very important us today to differentiate us as a doctor to know how to customize treatment according to this different skins, different features, and different areas in the face. Also, for me, one of the secrets of dermapen is that in every dermapen treatment, you have a little bit of dermabrasion. And this brings another level to the treatment. So comparing the stamping or the rolling where you don't have dermabrasion in either a small level and dermapen, which you can control, changing the speed, how much dermabrasion you have in a treatment. So for me, this is one of the secrets because it brings a certain inflammation in the epidermis and you bring more collagen analysis, more effective. And the 4th generation, which is very, very comfortable to use because it's wireless. What do we have? As science is always try to be my guide, even though we don't have a lot of heavy publications on the device. We do have publications on microneedling with dermapen, 11, 2 of them only with microneedling. Mostly they are used as boosters for other procedures, but as you're gonna see, there are publications on dermapen only. The interesting 2 things to think is how do we classify the treatments? Like in my clinic, to be ahead, to clarify what I'm going to show ahead, we divide microneedling treatments into the medical procedures, which are my procedures, only I do, and the esthetician procedure. The esthetician procedure are only myo treatments. So up to 1 millimeter depth and up to 5 or 10 passes. Not 10, not more than 10 passes. All of them are for me. So they're moderately severe injuries or severe injuries. The mild, I leave for her. So just to explain, because what I'm going to show in terms of protocols are a little bit different than the regular, lunchtime protocol that is so worldwide marketed. So I do it a little bit more aggressive, but just because I like doing procedures that are effective with the less number of sessions possible. That's all. So as you can see, I have a friend in Brazil that published a book, very interesting. He has a lot of experience with microneedling. And he calls the injury, the severity, because this is one way of teaching how do you choose the number of passes and the depth of the needle you like. So it's according to the severity you need or the grade of injury you want to do. So all injuries has different indications. So you can see I treat atrophic scar much more aggressive than I treat a melasma. Density is also something that you have to think about severity. So when I treat dark skin, okay, or melasma, I don't get so aggressive with the density, number of passes in an area, that I get when I treat atrophic scars or surgical scars or stretch marks.
Gabby, we lost you, I think. The connection looks not the best. We lost you.
Is it okay?
Oh, yeah.
So is it the same, or do we have to have a different technique?
But we don't see the slides now.
No, okay. Yeah.
Yeah, good. Now it's good.
So this is one of the best publications we have, made by Sasaki, and he compared PRP put on top of the skin after microneedling and looked into the microscope. So he did fluorescein, he did different analysis to try to figure out if the timing made a difference. Like if I would put microneedling and massage on top, would it make a difference if it is 5 minutes, like Paris said, depending on the timing, the holes are closed. So there is a perfect timing for this, which is not right away after the microneedling, but it's not an hour before or 20 minutes before. So you have a window of timing. So another thing that he found out is that when you do the microneedling and then you massage, sometimes your needle goes to 1 millimeter, but the liquid do not get to 1 millimeter. So what I prefer to do, and I did this myself, is that I tried, okay, does it make a difference with Dermapen if I stamp? So when you do a liquid and you stamp over the liquid, I found no penetration. So when I do the stamping with Dermapen and I put the liquid afterwards, the liquid do not penetrate as well as when you put the liquid first, put the Dermapen and move it around. So as you can see, I stained vitamin C with blue methylene, and I published these pictures in a book some years ago about drug delivery with Dermapen in Brazil. And it's very interesting because I could see, and I see clinically, when you do, every time I do a pass, I put the liquid on and then I do a pass like Per showed with the fat. So this is how I do. And if you, on top of that, want to massage the liquid afterwards, then that's okay. But the best penetration of this is when you put the liquid and you put the Dermapen on top. And then you can massage if you wait the right window of time and you massage for a minute, roughly on the skin, then you get penetration also. Another thing that Sasaki showed is that not all the holes of the needle are the same length. So when I'm treating, moving, not in the microscope, not all needles get to 1 millimeter. Let's say I'm using the 1.5 millimeter. Not all the needles get to the same length. Because of course, when I'm moving, sometimes, even if I'm slow, some of the needles do not have time before I move to get to 1.5. So in certain indications, such as acne scars, stretch mark, surgical scars, ice peaks, I do like to put my liquid on if I'm treating with drug delivery, do some stamping, 2-3 stampings in the same area to guarantee that my needle will get to the length I want. And then I do the moving on top. This is just a tip. So this was my assistant at the time when I started using the Dermapen, doing the roller on one side and Dermapen on the other side, seeing the dermabrasion factor that I showed. And this is for me the difference in between Dermapen and other stamping or roller devices. Another way, chest showing Dermapen compared to roller. So now showing the indications and what I use as a protocol. This is a mild to moderate severity injury. I use vitamin C 20%. Many people ask me. I don't have what Shino is going to show us brilliantly, the cosmeceuticals of Dermapen. We don't have it in Brazil, and I didn't have this at the time. But this patient was not an indication for isotretinoin, and she has been treating topically for a year. Then I started her, not by me, by another physician. She came to me as a very resistant case of type 2 or grade 2 acne. No pustules at the time, because as she was using already antibiotics, oral and topical, and benzoyl peroxide. So she had her regimen for 6 months. And then I tried to use Dermapen on her, but in the other webinar, many people ask about treating active acne, but remember, this case do not have any pustula, just papula. So if she would have pustula, I would have waited for the pustula to be gone, and then I could treat, or I treat the area that doesn't have any pustula, okay? So here you can see that I use vitamin C, and then after, but very mild injury, just 5 passes in the acne area, and the rest of the face 10 passes, but very not very deep. And then I use salicylic acid right away afterwards. And this is her result. At least she could have a little bit of an improvement. And she has tried other peelings before, hydrofacial before. So this was her best result. mild acne scar patient. This patient was very, very concerned about one area, specific area, non-distensible atrophic scar in this area. She had done hyaluronic acid injections, but she wanted something more permanent. So I did two treatments of Dermapen with vitamin C and non-cross-linked hyaluronic acid. Again, the same vitamin C, 20% sterile, and 2 treatments month apart. And this is the result. I never treat, you see, my protocols are never in one area only. Because I am so aggressive in that area with 20 passes, I mean, the skin look weird if you treat just one small area. So I normally treat less aggressively the rest, and I treat more aggressively the area that I want better improvement. This is a man that had treated his acne scars with hyaluronic acid, Sculptra, lasers, 2 types of the CO2 and Fraxel before, but he wanted something more. So I tried the Dermapen, 3 treatments every month, and this was the protocol I used. This is normal rejuvenation, like for a severe aging patient. She didn't want to do any heat technology, like energy-based device. She did Othera before, and she wanted something for her skin, but not IPL, not any heat technology. So I said, well, we can try Dermapen. So this is her a day after, and this is her 3 months after. Especially it was aggressive in the glabellar area. She had toxin already in the glabella in the first picture, and you can add up to your result. So years ago, maybe I would have injected with hyaluronic acid, but I think Dermapen is safer and you can add up the result. The only thing you need to tell your patients is that they're gonna have a little bit of edema, as you can see in the next day. It lasts for 2-3 days, not more than this, a little bit of erythema. I didn't have the cover recovery, but I recommend my patients not to use makeup for the first 24 hours, but the next day they can use because the holes are closed already. And those are a little bit of bruisings because of course those old patients have a lot of telangiectasia, so it's normal to get a little bit of a bruising. This is a melasma. So I need to say that Dermapen nowadays is my favorite treatment for melasma, except for peelings. So if a melasma comes to me, I normally classify if they are virgins, so never treated before. All of them use regimens, bleaching agents without hydroquinone. I don't like hydroquinones for melasma. And I've been using bleaching creams without hydroquinone for more than 6 years now. And what I found out is that Dermapen, if you do, you cannot do very frequently. If you, as aggressive as I am, like 10 passes, you need to do more of a spacing, like a month or 2 months, even better. I use tranexamic acid a lot. If I have dermal melasma, like this patient, very reactive, you can see the vessels on the left side, and it's a mixed melasma, dermal, epidermal. This patient had lasers before, injection of tranexamic acid before, but her complaint is that she would get better for 15 days and she would rebound very badly, especially in the summer. So I started her for a month before the microneedling on bleaching agents with non-hydroquinone. And then I did 2 treatments 2 months apart of microneedling with this protocol. And this is how she behaved. And this is 8 months after the 2 treatments. And this was in the middle of the summer. So she was very happy. And I see currently this, that the patients do not rebound so much. So of course, melasma, there's no cure, but even the most resistant melasma, and I have a very resistant melasma that I treated with Dermapen. So I really like it. I really like it rather than lasers for melasma. And this is another view. Stretch marks, I do use alone the Dermapen, but only if there are shallower and thinner, very recent stria. If I have old stria, larger, which I'm going to show afterwards, I combine with calcium hydroxyapatite injection. So this is a paper I published, a protocol I published, how I treat stretch marks that are severe and resistant to other treatments. So I used maximum of 3 ml of diluted calcium hydroxyapatite injected in the stria. Sorry, I don't know what to do. started. So this is normally how I inject the calcium hydroxyapatite, and then this is my end point when I treat stria. So normally my step-by-step is I put the vitamin C, put the dermapen stem 2-3 times along the stria, and then I move around more aggressively in the stria, but I move around the whole area around. I want this fibroblast around to help the stria to gain more extracellular matrix and to stimulate the migration of fibroblasts to the area. This is the pathology. So this in the middle is just microneedling. So you can see that with just microneedling, you can bring a lot more collagen and elastin. But if you have very deep stria, it's very hard to get with the microneedling deeper than 2.5 millimeter. So I need something else. So I found that combining calcium hydroxyapatite injected in the stria brings a lot more collagen in the basal layer, and it makes the atrophy, the remaining atrophy, much better, much faster. So this is some of the cases I had. This is 3 months. And this is another case, the right one with the butt was an 18-year-old patient, very severe case of stria. This is 8 months after. Alopecia, I don't have tons of patients with alopecia. I'm very conservative about using dermapen. I do like, you have to be careful not to use too much because you can scar there are some publications showing that if you microneedle a lot or you do a lot of injection of PRP too frequent, you can induce scarring of the scalp. So you have to be careful of that too. Old surgical scars. This was a patient after 2 years after abdominoplasty. She tried right after PDL, she tried IPL, she tried CO2 laser, Fraxel, but she got hyperpigmented. And she was very concerned. I did one treatment, very aggressive with microneedling, and she was very happy. Hypochromic scars. This was after facelift, the complication of a facelift of a colleague of mine in Brazil. She sent the patient to me, see if I could do something. So I tried lasers before, but really it helped with the hyperpigmentation, but not with the hypopigmentation. Not even Fraxel helped. So I tried dermapen, and it really helped. And it's really interesting. Some cases I combine with the calcium hydroxyapatite injection inside the scar, but this one is dermapen only, and one treatment really improved. So what about recent scar? I mean, really recent, like right away when you take the stitches out. Can we help healing modulate the healing? Can we do something? Can we add something to that to kind of modulate the healing or guide the healing to lower the frequency we have on hypertrophic scars? Not for keloid. This is not about keloid, but for hypertrophic scars and the appearance. So I was very curious. So I was trying since many years when Wolf and Vu went to Brazil and he presented the keloid, the toxin, botulinum toxin for keloid. I said, why not for hypertrophic scars? So the basic sign, there are some literature showing that you can modulate the amount of myofibroblasts if you put small dose of toxin. So I tried toxin alone and I tried microneedling alone for scars, but alone they're not perfect in my opinion. One, you can control the redness, the other one you can control the appearance, but not too much the redness. So I tried to combine both of them. And this is, I tried in patients that I operated for cancer because I am a Mohs surgeon right away. So on the 7th day, I took the stitches out, flaps on the face. And then I compared with patients that I didn't treat before and I operated myself. So it was interesting to find and that it was very significant, the satisfaction of the patient and also the appearance according to the Vancouver scale with 2 blind evaluators. So how dermapen can help? So I told about the toxin. So dermapen stimulate in the first phases of inflammation is stimulate a lot of TGF-beta. And the TGF-beta stimulated by also the PDGF, which is the platelet growth factor, stimulate the formation of extracellular matrix and also the migration of fibroblasts. And this is very interesting because all of this stimulated the deposition of collagen in a more organized way. So this was the protocol I used to put toxin and microneedling same day, injected toxin, microneedling on top. I'll show in the 7th day after surgery, right when I take the stitches out. I'm dealing with face, because the face I use PO7 to take the stitches out. And then I would do microneedling again 15 days. So this was statistically significant. The evaluation, the score evaluation of the modified Vancouver scale, and also the patient satisfaction. So this is how I dilute the toxin. If you get a 30 units syringe, you put 3 units of botulinum toxin. I use both Xioming for this. So I diluted the vial of Xioming with 1 ml of saline. I'm already telling this because the last webinar, a bunch of questions about this. So I'm already telling you, and I'm adding the where it's going to publish in JDD in June, I think. So 3 units of toxin and 7 units of saline. Every 3 units, 7 units of saline. And this is how you inject the scar every 5 millimeter around the scar. And this is how I do the dermapen around. You see that I don't treat only the scar, I treat around. And I'm even more aggressive than my regular protocol. So I do 20 to 30 passes, depending on how high and how atrophic the scar is, right away when I take the stitches out. So this is a patient, the day I took the stitches out, this is a month after. Compared with the patient where I take the stitches out that day, first picture, the second picture. You can say that in 6 months, maybe it won't make a difference. Maybe I should have followed my patients up. It's just in the public service in Brazil, it's a little bit difficult to get the patients to come back. And it's the same in the clinic. Sometimes the patients are from other states. So if I could improve my patient life in the first month, nobody wants to walk around with a red scar in the middle of the face. And this is a costless procedure. It's really cheap. I mean, you use 3 units of toxin, it's really cheap. It's not expensive. This is a case even with necrosis of the tip a month after, and this is a case, same flap that I didn't treat. Glabellar flap, I didn't treat. So you see that the improvement is drastic in my opinion. If I would have a scar on my face, I would like somebody to treat me. So, and this is the patient I showed, and I decided a month after to do the same treatment and see if I could improve something. So she's much better after a month after treatment. So take home messages is to decide how you're going to treat. If it's a medical procedure, if you want a lunchtime procedure, decide the density and the depthness, decide the injury, the severity of the injury you want for each of the indications. To guarantee the penetration of your needle very, very even, stamp first if you're dealing with very concentrated lesions like surgical scars, stretch mark, acne scar, just stamp a little bit and then you move around. We need the moving, okay? The moving is important for the drug delivery and for the outcome. Those are the indications that I recently used. I hope to use for new indications like more and more. We are, as I have, my husband is a plastic surgeon, so we are more and more adding to the plastic surgery procedures as a daily basis. And to guarantee the penetration, again, remember the technique when you use the drug delivery. And I also treat the surrounding areas. Thank you so much.
Thank you very much, Gabriela, for a fantastic presentation. And now we will move to our last, but not least, our favorite friend, Chino Bay, that will be presenting on DP Dermaceuticals, Advanced Integrated Skincare.
Hello.
Please,
Thank you, Alona. Let me see if I can share my screen right now.
Yeah.
We get started.
Actually, there were couple of questions about the combination of if it's vitamin C or other products would combine with the dermapen treatments. And that's why what Chino is going to present you is why dermapen develop all of these products that they are really safe, very safe, and they're even very much recommended to use during the treatment and through home care So like this to maximize the results, or to ensure, to avoid any complication or stuff like that. But I will leave the stage for Chino to speak more about this. Thank you, Chino.
Thank you so much, and great presentation, Gabi and Per. As you heard them, you know, microneedling with the DP system is one of the superior systems that have ever been into the aesthetic market compared to other devices out there. Well, as Gabriela said, there's a lot of requirements that need to be met in order for this technique to work, and that includes, you know, the depth of penetration, and also how well you can glide the microneedling system without having friction. And this is where I think the products from DP Dermaceuticals come handy in order to achieve those results, to enhance the results, and actually get to the outcomes that we try to deliver to our patients. One thing I wanted to say is that whether it's microneedling or any energy-based device or any treatment that you do in your clinics, if you do not give an integrated protocol skincare system for the patients, studies have shown that they will go out to the mall and they will buy themselves something to support that treatment. That is actually something that we need to avoid, because number one, they depend on us to guide them and to allow them to pick products that are going to not only care for after treatment at home, but also enhance the results at home. So keep that in mind if you do not dispense products at home, or you don't have a product like this type of product that are designed for after procedures, because the patient can get a product that has the wrong pH, has the wrong concentration, or have too much of an active ingredient that can be irritating, making an adverse reaction at home. And the patient may blame you. And again, we are to blame because we are the experts, and we should guide our patient as what they need to use after a procedure at our clinics. So this is me, you know, I just dermatologist just like Gabi in Fort Lauderdale, Florida, which is very close to Miami. And I have a really great passion, since I can remember, for skin care and skin treatment. So I'm gonna talk to you a little bit about what makes dermaceutical for DP special. One thing to just remind you, most hyaluronic acid formulations out there, at least in the United States, they do not penetrate the skin. Most of them, the glycosaminoglycan molecules are too large to penetrate the skin. Even the nanotechnology that people come to our practice and tell that they have nanotechnology for hyaluronic acid, none of them will penetrate the skin except this technology on the DP dermaceuticals. And I'll tell you why. I'm gonna show you a little video, and this is gonna illustrate it better than I can. So this formulation is the halofuse complex that contains 3 molecular size of hyaluronic derivative. Small molecular size 10 kilodalton, medium 1600 kilodalton, and the large 1800. The large molecular weight just stays on top of the skin, fortifying barrier function, smoothing the skin surface. The medium size does get a little bit deeper, and that contributes to a continuous moisture retention. The skin will appear plump and smoother. Now we have the magical part, which is the small molecular weight size of this hyaluronic acid, that it works as a delivery system of bioactive ingredients. Never before. So it is, remember, it is hyaluronic acid at 10 kilodalton. So it will only drive those molecules or those bioactive ingredients that are water soluble, but it will go down to the deeper layers of the skin, having a physiological effect on the skin. The thing that is great about this product, and as you heard, Gabi, that when you use this microneedling technique, one thing that is important is the constant movement, right? If you don't have something that helps the skin the microneedle glide over the skin, you may not be getting the right depth of penetration with all the needles on the microneedle system. So this mesoglide technology for this kind of fuse on this formulation is amazing. The other thing that you hear about, Gabriela, is that when you use products first, and then you do the dermapen or the microneedling system, is a lot better than you putting the product after you do the microneedling. So with this mesoglide system, with hollow fuse, you can actually apply the product first, glide the microneedling, enhancing the penetration, enhancing that the bioactive ingredient penetrate deep under the skin. So it's something that is desirable that we all want. So again, if you do not give a patient a system, a protocol, they will go and get them themselves at a department store. And again, that will not enhance the results, and worse, it can cause adverse reaction at home. So like any good protocol, everything starts with a clean slate. So we recommend our patients to utilize the Dermapen dermaceutical cleansers. We have two types of cleansers, one for problematic skin and the other one for skin that needs more nurture. Now, both cleansers are incredible because like anything on this system, it does have the halofuse hyaluronic acid technology, meaning that as you cleanse the skin, as you remove traces of debris or makeup prior to a procedure or to treat it at home, you actually hydrating the skin, which we don't want a patient that using any aggressive treatment that we've done on our practice to use a cleanser that is going to actually irritate the skin by being too harsh because the pH is not the adequate pH, or because it has a lot of ingredient that's going to strip the skin of its natural oils. So we have the tri-phase cleanser, which is for a mature skin. And then my favorite cleanser, the CLR, the clear foam cleanser, that is for problematic skin. Now, one thing that we recommend in our practice for patients, we always want to make sure that the more you have, the more debris of the skin that you have on top of the area of treatment, you're not going to allow things to penetrate. And we want bioactive ingredients to penetrate deep under the dermis to have a physiological effect. So we recommend the patients to use this amazing exfoliant, which is the microderm exfoliant. Usually 3 days prior to the Dermapen treatment, it is recommended. It does have bamboo powder. Compared to other bamboo exfoliant, which have actually the seeds that is ragged or having crystals. Sometimes patients go and buy products that it gives you like an immediate gratification, like especially like those microderm exfoliant that have crystals. The problem that it will give you an immediate gratification, but long-term, if you continue to use this type of dermal exfoliation, mechanical exfoliation with crystals or bamboo seeds, what you're doing is more harm than good. And we love this bamboo powder with lactic acid because it will naturally and gently exfoliate the skin from debris of the skin, allowing the bioactive ingredients to penetrate after any microneedling technique. Now, before you do any procedure that you're gonna break the skin, we recommend using this product. In fact, in my practice, I have it by the gallons. Why? Because hypochlorous acid is being well known to kill pretty much any pathogen on the skin. You know, I always joke that it kills everything except the patient. It's safe if you spray this on a patient's eye. It's not going to harm the eye. And actually, sometimes I get a gauze and clean the skin inside the mouth if I'm going to do a procedure that I have to get close to this mucosa. So it is an amazing. We go even to the point that before we inject anything, I spray my cannulas, my needles, my syringes with this to enhance that there is no any chance of infections after any procedures, including injectable fillers and neurotoxins in our practice. So it's a must-have prior to microneedling, but for me, it's a must-have prior to any procedure in my practice. Now, this is the Hala Active, which is what you have on the HaloFuse technology. Again, the 3 different molecular size weight will allow for different things. This is something that I have to express because the vehicle in every product, any product that you use on the skin, vehicles are very, very important. Why is that? Because the vehicle allows for penetration, but also allows for a better, easy procedure. As Gabriela was talking about, gliding the microneedling technique is very, very important. Things like that is important, a lot of people don't think about. But the Hala Active with the Mesoglide allows for an easy glide of the microneedling, but also allows for easy penetration of the bioactive ingredient. Why? Because it has that small molecular weight, 10 kilodalton hyaluronic acid that does penetrate the skin compared to other ingredients. One thing that is something that I can tell you with one pump of this Hala Active gel, I'm able to cover my face, my neck, my chest, and both arms. So it shows you the potent vehicle that this HaloFuse technology is, that it has virtually no friction. It allows you to cover a large surface area with only one pump of the product. It does it also with this antioxidant cocktail. When you're doing these procedures, you gotta match the skin type, the outcome that you wanna give. So I usually recommend the antioxidant cocktail for patients that are looking for a microneedling treatment for anti-aging, because we know the importance of vitamin C, not only in the production of collagen, also regulate pigmentation, but also we know that a potent antioxidant that vitamin C has, it will allow the skin to be protected from the environment, pollution, and any reactive oxygen species created by our own metabolism. It has HaloFuse like every other product in this line, vitamin C, niacinamide, arginine, and zinc CO2, which is a potent collagen stimulator. It's amazing for aging skin and sun damaged skin, but also it regulates pigment. So anybody that has pigment problems. The bright light is for your patients like have something like melasma. As Gabriela said, at least in Florida and Miami, melasma is our biggest headache. It really, really becomes a big problem. When you have a patient with melasma, you basically are married to that patient for the rest of their life because, you know, we can get them better, but it all depends what they're doing at home. So if you're doing a microneedling treatment or a chemical peel that is good for pigmentation, but the patients do not have products to use at home as an adjustment to the treatment to enhance the results, but also maintain the results, you're actually doing a disservice to the patient. So the bright light has licorice and koji aji. I agree with Gabriela that hydroquinone is cytotoxic, is mutagenic, and it creates a lot more problems in long term. Like you could get exogenous ochronosis by using hydroquinone. So trying to use hydroquinone-free product is the goal for any dermatologist because we are well aware of the cytotoxicity and the toxicity and mutagenicity that hydroquinone has on the skin cells. So this bright technology again has the HaloFuse technology, which it will penetrate the skin to the deeper layers of the skin, but it also has licorice and koji acid, which are natural skin bleach agents that will allow with any type of pigmented skin. Any skin that you're doing a microneedling treatment, or basically in my practice, we do a lot of laser technologies too, but we need something that is going to nurture the skin. And when we talk about nurturing, you think about vitamins that have a physiological effect under the skin. This product has vitamin A, B, C, and E. It has grapeseed oil, aloe vera, and resveratrol as an antioxidant. So it's a very potent antioxidant that will allow your skin to build its natural barrier. And you could use this at least 10 days post-dermapen treatment. Retinol active. Retinol active, we know that there's thousands of papers that talks about the importance of retinoic acid, whether it is prescription strength, over-the-counter retinol. The beauty about retinol is middle of the road. If you have a retinol formulation, it needs to turn into retinol, and from retinol, it will turn into the active ingredient, retinoic acid. The problem with retinol or the active ingredient, retinoic acid, the prescription strength, is that they both are very drying and cause irritation. So some people cannot tolerate it. The middle of the road, like anything in life, right? Anything in moderation. Retinol active have retinaldehyde. That is only one step to turn into the active ingredient. So you have more of the bioactive ingredients that creates the collagen, but it's less irritating than either or retinol formulations or the prescription formulation. So it's really a very powerful vitamin A derivatives that does work in enhancing the results of your anti-aging dermapen treatment. It will do it by activating the RAR gene and also inactivating the metalloproteinases that, for example, collagenase or gelatinase, that will break down collagen under your skin. So it's very, very important for any anti-aging treatment to have at home a protocol that contains retinaldehyde as a beneficial agent post-treatment. The CLR lotion is for problematic skin. Anything that you see CLR or clear is usually for skin that is acne prone skin or combination skin like the one that I have. You have, again, the halofuse technology and Manuka honey. Manuka honey is like ancestral medicine for skin. It's been from the times of Cleopatra. We know about honey and how great it is as an antiseptic, as an antibiotic, natural antibiotic, but also has a lot of anti-inflammatory properties. Niacinamide, which is added to this ingredient, is great for pigmentation, but we know that even for patients with rosacea, niacinamide tends to calm the skin and reduce redness. So it's great for problematic skin. And it also contains oligopeptide 10, which happens to be another product that will work as an antibiotic. Salicylic acid and lactic acid is great for cleaning the pilosebaceous unit to help with comedogenic type of skin. So if you get rid of the comedone, you won't have as many pilosebaceous units infected with the pig Aedes bacteria, so you will clear the skin a lot faster. For anti-aging type of products, as Per showed the amazing results doing by the microneedling around the eyes, but you also need to support this type of treatment. So the skin of the eye, under the eye, is a skin that is the thinnest skin on the face. It has a lot more requirements. We show aging in area of movement. We blink about 20,000 times around the eyes. That's why for us, we're gonna start showing sign of aging around the eyes a lot sooner than other areas on the skin. So doing something like microneedling with the dermapen treatment, it will enhance the results, but also we need products at home that's gonna support this type of treatment. So we have my favorite eye cream, RER Eye Serum, which I actually combine it with the RER mask for under the eyes. It will make the active ingredient penetrate a lot faster, and for me, it's a must. I do not travel without this regimen under the eyes because almost 52, that's where I'm basically showing my sign of aging, but with this product, I'm seeing amazing results. Remember something, if you don't give a reason for any human tissue to regenerate, it will just deteriorate. So that's why microneedling, that control injury to the skin, will cause your skin to basically wake up and try to repair itself. But in order to do that, the matrix, the extracellular matrix where the fibroblast resides, needs to have the right amount of active ingredients to help the fibroblast thrive and do what it's supposed to do, to create more collagen and more elastic fiber for a skin that looks a lot more younger and rejuvenated. The dermapen circles also have different things that you can add to the microneedling treatment immediately after. We have two different types of pills. This is the Uber Pro pill. Basically, you do the microneedling treatment, you add the Uber Pro with a brush or gauze, then you neutralize it with one of the Hala Active 3D masks to neutralize the pill. But also, again, it has still the Hala Fuse technology that will allow to neutralize and calm down a skin that's being processed. Since this is a double process in one treatment, you want to make sure that the nurturing of the skin is even accentuated, enhanced with one of these masks. And then we have the Uber MD pill. This should follow the same protocol. You do the microneedling, you add, but instead of doing full face, you use a special toothpick, and then you just pinpoint the area like an acne scar, like an ice pick scar, or a scar that you want to treat, or any distinct hypigmentation like age spots. You want to frost it over with this Uber MD pill, and then you will neutralize it again with one of the sculpture masks, according to the result you want to achieve. And this is the mask that I was talking about. Actually, I was doing one of these to my mother on her face and hands. It's unbelievable. So you use this, leave it for about 20 minutes. You're gonna see that your skin looks more hydrated, plump, and if you use it around your eyes, the way I do it, it's almost like you did a blepharoplasty. Okay, it's not gonna last, you know, but for 8 hours, you look like you did have one. It's incredible. It's a must-have for those of you that travel a lot. Now, this veneer skin is something for me and my practice. I live in Florida. From time to time, we do have the temperature to drop to, you know, we get excited when it drops to 65. That's when we think it's very, very cold for us. But for skin that once the winter comes, I tell my patients, stop using the retinaldehydes or anything that contains tretinoic acid, continue the Hala Fuse and seal it with this skin veneer because it's a lot more hydrating. It has triglycerides, squalene, peptides, and cholesterol. So it's for skin that is more dehydrated. A postmenopausal skin that seems not to get any hydration, if you do a combination of Hala Fuse and then you seal it with a veneer, they're going to love you for that. Now, when you do any of these procedures, especially microneedling, the skin immediately is going to be red. This is an amazing product, the Cover Recover. Why? Because not only it works as a BB cream, you're going to attenuate the redness. In fact, when you do this immediately after, patients will not look like you did anything to them. So most of my patients love it and they use it as their makeup because it's a smart BB cream or a smart light sheer makeup coverage because it has SPF 30, so we are protecting the skin from UV light. It has vitamin A, E, copper peptides that we know copper peptides actually works to not only nourishing the skin, but it's a pro-collagen and it helps with wound healing. It has the Hala Fuse technology like anything else. So, and probiotics. So this is a smart light coverage makeup or BB cream. It has zinc oxide and titanium dioxide. And it comes in 20 shades. So you can actually blend and mix and match any skin type that comes to your practice and get any of these procedures. Now, really quick, you could see here for yourself that, like I mentioned before, if you don't give this to your patient, they're gonna get it somewhere else. So this is a good way of revenue for the practice. So it will enhance passive income in your practice Your patients that are doing aesthetic clinical procedures in office want this. And if you don't give it to them, they will get it somewhere else. And if you, in my practice, we're doing microneedling, we'll give a kit to them because it is important. And I cannot stress this enough. It is absolutely important that the patient has a protocol for at least 2 months after microneedling. And in my practice, at least this is what I use for anti-aging. Why? Because with one pump, I can glide from my head down to my neck, chest, and both arms. And I'm not making this up. The gliding property of this is virtually frictionless. You can actually cover damaged surface areas with one pump. And I can do that with the antioxidant cocktail and with all the other products. So that is something amazing, because which other product I cannot remember, because I carry a lot of other lines in my practice, but nothing else I can glide it like that and cover so much surface area. But I use this as my own personal anti-aging product, but also my patients, I tell them for at least 2 months, 6 months if they can. They love it. So we have a kit for anti-aging, which contains the triphasic cleanser, antioxidant cocktail, the vitamin-rich repair, and the retinol active. If you have pigmentation, again, you add the bright light technology into the mix, and everybody gets to, or is recommended to do one of these 3D masks. They're amazing, and they will deliver more of the bioactive ingredients after they do these microneedling techniques. Acne, they will use the kit that lasts about 2 months for problematic skin. So it has bright light, because we know that especially if somebody skin type 4 like me, I get rid of the pimple, but I'm left with a blemish, a brown spot that on me can last 4 to 6 months. But with the bright light, I can accelerate the process so I have an unblemished skin. Now, there's something new. I think now it is on the market. It wasn't here in the United States, but the MG collection. The MG collection I use it for mega dose. All these amazing ingredients that I told you before, copper peptides, kojic acid, vitamin C, they're all delivered deep into the skin with the halofuse technology. But remember, peptides, they're hydrophilic. Vitamin C, hydrophilic. But what about if we need to drive under the skin ingredients that are not so hydrophilic? Remember, the skin, the cornea or the skin is hydrophobic. We secrete special oils to keep that lipid bilayer, so to keep that hydration, to prevent the transepidermal water loss. So the stratum corneum is not so hydrophilic. So what about if we're trying to drive ingredients or bioactive ingredients that are not so hydrophilic? This is where we have a different vehicle, which is calfosome. The benefit of calfosome is that it's compatible with all bioactive and improve the stability and sustained release of all the bioactives that we're trying to drive under the skin. Yes, these calfosomes are biodegradable and they're non-toxic and non-mutagenic. So it's used to bring things that are hydrophobic, if you want to see it that way, down deep into the skin. A different way of having a delivery system to bring bioactive ingredients deep down into the dermis. So they have a huge gamma of line depending on what type of treatment you want to give: anti-aging, pigmentation, scars, striae. So you customize this treatment. So instead of using your halofuse original Mesoglide, you can actually charge a little bit more, because these have mega doses of the active ingredients and different ways to deliver it. Now, patients can buy this on their own and use them at home themselves if they have the resources, because it is a little bit expensive for them just to use it for at-home treatment. But can they buy it? Yes, we can do that. But it's really used to use it in a way to glide the microneedle needles and penetrate more of these active ingredients with a higher concentration. So we have the MGH35, which is for a younger skin that want to start to restore, refresh, or enhance the skin. Then you have the MGH35 plus, which is give you an intense hydration and is for age correction. It does have the calcium, telomeres, vitamin C, retinaldehyde, vitamin E, and zinc, which we know zinc is great for wound healing and DNA repair. And again, it does have the half-use technology. And the pH is correct. A lot of times you have a lot of products with a lot of claims. We have great vitamin C, and we have great retinaldehyde, but sometimes the concentration is not proper, the stability is not good, and also the pH is not good, which having the wrong pH in a treatment like microneedling can be the kiss of death. You can actually be doing more harm than good, because if you have severe irritation, inflammation, you are not going to be delivering the results you want to get with microneedling. Everything has to be supported. That's why Dermapen created a protocol to be able to deliver bioactive ingredients safely, but in a more nurturing way, right? Nurturing the skin as you're doing this. It's bad enough that we're having a control injury. We need to actually, right after that control injury to the skin, to stimulate collagen and elastic fiber, you better bring into the area a lot of bioactive ingredients that support wound healing, that support collagen stimulation, and that is going to reduce inflammation. Now we have the MGBL, which is for your skin that have all this type of pigmentation problem, whether it's melasma or, you know, I live in Florida, so even I get a skin that tend to be prone to pigmentation because I grew up in Panama, a lot of sun, and I will never use sunblock. You know, it didn't exist when I was a little boy. That shows my age. So I tend to struggle with pigmentation on my skin. So I have to use something to discourage the pigmentation from prior UV spot. So again, it has kojic acid, vitamin C, licorice, bilberry, copper peptides, but is a mega dose of these active ingredients. The MG-RAS is something that, you know, we saw amazing pictures from Gabriela doing her treating scars and also stria, or you could see that if, you know, I'll be very interested to follow and see studies using this new technology, the MG-RAS, to see how fast we can get to the results. We know that microneedling is amazing for scar, but what about combining the technology with the support system, with all these amazing bioactive ingredients that promote collagen formation, that discourages metalloproteinases to destroy collagen, that has the right amount of hyaluronic acid in, to have the perfect extracellular matrix for the fibroblasts to thrive and do what they're supposed to do. The MGCLR is for problematic skin, right? Clarify, unify, help with all these problems with acne. It has niacinamide, copper peptides, licorice, kojic acid, everything that you need to discourage the acne production, but also to repair the damage caused by the inflammation in the pilosebaceous units. And this is, you know, a picture speak 1,000 words. You know, just like Gabriela was saying, I will treat the infection first. It's time treating the patient. This patient failed antibiotics, failed Rocutyne. She did anything that she could have done with dermatologists, and the only solution for her was doing this microneedling treatment with the MGCLR. This is after 3 treatments, 2 weeks apart. For pigmentation, we would say the melasma or Asian tend to have a lot of problem with age-related pigmentation that also looks like melasma, which is a lot more difficult to treat. You could see that this is an amazing result for skin brightening. And one thing that we know that the problem with melasma is that anything can that cause a lot of inflammation or heat can make it worse. And I agree with Gabby that for me, microneedling is one of the ways to go to help melasma, because when you do a laser, if the wavelength is short, that wavelength can stimulate more melasma. So we need long wavelength, but not even that. It could be the right wavelength, it's short, but the heat itself generated that causes more inflammation may make the melasma worse. So I much rather do something gentle that causes very little heat and very little inflammation, and using a supported system like the MGBL megadose ampule to do this treatment that ensures me better results. Now the MG-RAD is great for skin that, you look at the skin, you guys, you could see that this is severe sun damage. I would say like a skin like that needs Jesus, Moses, Muhammad, and everybody that you can pray to fix this type of skin, or old-fashioned CO2. Like, you know, send it to Per, and, you know, he's the God. You know, just send it to Per that other than God, he will be able to fix the skin. And what did he show to us? That he was able to get great results with microneedling without having the downtime, especially this post-COVID. Post-COVID is a different world, you guys. The world of renew ended. And a lot of people are gonna be very reluctant to do fractional CO2. The doctors are gonna be kind of a little bit afraid of doing it until things, you know, get better. And patients don't wanna have anything that they're going to have a lot of downtime or compromised skin. Now, with the microneedling, I think we can give the patient results that they want, the real possible with very little downtime. And I think microneedling is gonna be something that we're gonna see a lot in the future. We saw that we could use the same product, the same ampule MG-RAS combined with MG35 plus. You can combine these ampules of mega doses to accelerate and enhance the result. So you can see the beautiful treatments for stria, stretch marks, and scars. Very, very, very proficient. Amazing results, very little downtime, with a lot of science behind. We could see rosacea. Again, rosacea skin that sometimes you look at it, it gets irritated with anything. This is an amazing result. Mega dose. You can combine here the MGH35 with the MG-RAS, send them with a kit. Remember, I cannot stress enough. If you do not give a protocol for the patient for at least 2 months, you may not get the result that you want, and you may have that patient do his own things at home. Patients like protocols. Patients believe doctors, and they want to, if they pay money, they will pay whatever it takes to support whatever treatment they're doing in office. Believe me, that's the way we do it. And thank you so much for your wonderful attention. And I hope this combination of Tweet Talk with Per, Gabriela, and myself have enlightened you to what is available out there that requires very little downtime, but give incredible results. And the last thing I want to say, just with Per, I had the great opportunity to be given by Per to be in charge of the non-surgical aspect of BTS. And unfortunately, because COVID-19, we want everybody to be safe, and the right thing to do was not do it this year. But what does that mean for us? For us, it means that now we have more time to have a much better program for 2021. So it's gonna be something that you've never seen before, with a lot of love, with a lot of light, because we believe in education, and we have created one of the best programs in the world. BTF 2021 is going to be where all the key opinion leaders of the world will congregate, not to teach you, but also to learn from each other. Thank you.
Thank you very much. You know, we're all going to be there in next BTS. And thank you so much for such a great presentation. And just for you to know, I would like to announce that due to the previous webinars that we did, and we had a lot of interest about our DP dermaceuticals. So we are opening a special offering for the clinics for this month for 20% bonus, free goods on what they are ordering. So for this, you can please contact your local distributors or Dermapen World. And we will be very, very happy to give you more information if needed. And now I'm would like to open for some discussions and Q&A. Actually, we got plenty of questions that we will not be able to address due to the time limit. All of them, obviously. Some of you got some replies, but what we definitely for sure, we will get back to all of you with all the question and answers. So everybody will get what they wanted to know. Now, first I would like to ask Per, question for you, because you were speaking about also combining AJ fillers with botulinum toxin with your treatments. So can you please speak a little bit further about this, about the way you do it, about this dosage that you are doing it first? You are injecting what comes first this, and then after the Dermapen, or the other way around. So if you can speak a little bit further about this, that would be great. Thank you.
So combining Dermapen with other injectables, I would say, and it goes for both fillers and the botulinum toxin. And to address botulinum toxin first, there are obviously different goals. And if you really want to get the effect on your muscles, you are injecting the product into that region. So for instance, if you treat the corrugator, obviously you go very deep, close to the glabella area, because that's the origin of the muscle. And then it inserts into the central part of the brow. And then you go slightly more superficial, but everything is still underneath the dermis. And that's where you really want your product. And I think if that is the goal with the toxin, you obviously should use an injectable technique with a needle. And I usually use an insulin syringe. I have used mostly Botox or Vistabel. I've had experience with all of the other toxins also, but I've used most of that. I use a insulin syringe and inject in a standard way, but always individualized. When it comes to distributing hyaluronic acid into the skin with the microneedling, it's a totally different thing. Then it's more similar to microbotox. You want to affect the more superficial part of muscular activity or more of the dermis, and the depth of the penetration of the product is much more superficial. So it has more to do with structural improvement of the skin. and you can dose it a slightly different way, but I usually put 1 ml or half an ml of the Hyalaglade solution together with 1 ml or 50 units of Vistabel, and then I put it on the surface of the skin and use the Dermapen to penetrate the skin with the toxin. I think there is no real science about the best way of doing that, but we have to think about the mode of action for how the product acts in different regions, and realize that with the microneedling, we don't get penetration of the product so deep, but we obviously has a bit of diffusion of the toxin. So the stronger the concentration is, and the more of the material you get into the skin, the more likeliness you have of also giving a little bit effect on the more superficial part of the muscles. And I have not seen any publications on how to put the product into the skin in a controlled way to evaluate the effect of the botulinum toxin with Dermapen. But my personal experience is that you can get skin structure improvement by doing that.
Okay, thank you very much. And also around, the orbitals, around the eyes, what is the depth that you are treating with the Dermapen?
With Dermapen, I usually have a setting of about 0.2, 0.3 millimeters. And I think if you would like to, if you think about the botulinum toxin treatment, obviously there is higher chance to get muscular effect if you treat the crow's feet, because the orbicularis oculi is very superficial directly underneath the skin. And if you put a little deeper setting here and then use botulinum toxin, I've seen effect on the crow feet related to the orbicularis oculi. Whereas if you go on the forehead, it's a little thicker skin and you have to go deeper then, and the muscle, the frontalis muscle is slightly deeper. So I think the area where you have highest chance of getting botulinum toxin effects is the crow's feet area. But for improvement of the skin structure, I usually have a setting of about 0.2, 0.3, possibly even a little bit more than that. But when you treat with microneedling, you should see that you should actually do a little pass first. You put the setting on what you like, what you believe is best for that skin thickness, and it varies from one individual to another. It's different from a man to a woman, and it's also a variation from one person to another. So you have to test, and the way you test it is you put your Hyaluronic on and you make 1 or 2 passes and you see what type of reaction do you get. And you could, in the standard treatment, especially if you want to have dermal effect, no, you're not just treating the epidermis, you want to see pinpoint bleeding. So if you pinpoint bleeding, you're usually at the right depth. But as I said, if I want to do more aggressive treatment, I have a patient in general anesthesia, then I would use much more bleeding. I see more pinpoint bleeding. I see more vascular reactions, and I do the treatment in a much more aggressive way with many more passes than the traditional 4 passes. The traditional 4 passes used by any skin therapist, usually 1 vertical treatment, and then 1 oblique treatment in one direction, 1 in the other, and then a horizontal treatment. So that's usually the 4 standard treatment. I think there is no real science about if we have to do 4 passages, or as Gabriella addressed, we can do more passages. And I think it depends very much on your experience as a plastic surgeon or a dermatologist on what type of reaction do you see in the skin. And it deals with everything you do with the skin. If you do laser peeling, chemical peelings, you do microdermabrasion, you have to look at the skin and you have to have experience on judging what is the skin reaction that you see.
Okay, thank you very much. And Gabriella, for you, obviously there is a huge demand from especially the patients, women's sides, to treat the neck and décolleté. That this is not every treatment you can address that. What do you think about this part treating with Dermapen, with microneedling?
Specifically the neck and the chest, is that it?
Yeah.
I like it very much. Many patients of mine that I treated with CO2 before, and I was a little bit concerned of treating the chest because the skin was too thin, or there are too many vessels, and the erythema, post-erythema of CO2 is super large. So I started combining procedures on the face and neck and chest with Dermapen. It's really, really good. Even the thick wrinkles with Dermapen combined with hyaluronic acid And for the poikiloderma, vitamin C is really, really good.
Okay, thank you very much. And another question that obviously you have many different modalities at your clinic and a lot of energy devices. So, and still, like you are very much recommended in many of the other indications, dermapen use. So, can you please a little bit direct from your experience, what are your preference, energy devices versus, microneedling treatments?
So I like lasers. I love laser, don't get me wrong. And as I was in a university in the department of laser, I was exposed to all the brands and the type of machines. I myself have everything you have available in the market, not everything, but a lot of them. And still dermapen is the most frequent procedure in my clinic. So, I mean, I can add dermapen to anything I want. I can do microfocus ultrasound and dermapen. I can do fillers dermapen. I can do to kind of, I have a 360 theory. So, I mean, if you treat all the layers of the skin and the skin envelope, you get a much better result. So I can combine dermapen with anything. So micro pulsed YAG laser that goes deeper. I go superficial with dermapen. And for some things, I have a special preference for dermapen. One, because I have very little complications. In more than 1,000 cases I have, very little. I only had 2. I already responded when one of the attendees asked me. So I had only 2 complications on the body. So my preference are for acne scars that are not distensible, like box scar, ice picks. I prefer dermapen than any other technology. Of course, if you have all them combined, you have to combine in different sessions. No, you don't combine CO2 with dermapen in the same session. But if you have other types of acne scars, I would combine, but for atrophic and distance and ice peak, I prefer dermapen than any other device. For melasma is my preferred treatment. For dark skin and skin rejuvenation, so bringing collagen and elastin to darker skin, like type 4 and up, is very good. And although they have dark skin, you have to be a little bit more conservative with the protocols. But it's very nice and it's very good for them, and you don't even see the erythema afterwards, so it's pretty safe. And for patients who are, especially because I live on a place now that you're exposed to the sun all the time, dermapen is very safe, really, even in the summer. So, and it's shorter. The downtime is much shorter than other technologies like non-ablative, fractionated laser, or CO2. So,
Gabriela, the connection, I think it's, hello, Gabriela. Okay, Chino, we will, I will ask you a question until Gabi will get back to us. So actually, you got the same questions because, you know, in your area where there is a lot of sun there and many dark patients and so on, and you see it's obviously in your area, you are leading doctors over there. You see many patients. When they are coming in, how you choose which treatment to give for instance anti-aging or the most popular melasma and all of these very popular indications that patients are looking for.
Well, there's a lot of modalities that I can use in my practice. Again, I'm a laser institute, so I have pretty much any laser that you can imagine. But the problem is that, yes, we live in Florida and it's sunny all year round. And trying to get a patient to have downtime or or do a procedure that is going to take a lot longer to heal, or they have to do too much at home, it becomes a big problem. Like, so with microneedling, patients are choosing to do that because they know that the downtime is going to be low, that they can actually conceal, so they can actually go to work the next day and nobody's gonna really know what they've done. That's from the patient side. From my side is I have limited lasers that can work well on skin types 4 and above. So when I use microneedling is colorblind. It really can be safely used on all skin types, and I don't have to worry about post-inflammatory hyperpigmentation, which from time to time, you know, even that I planned well, even that the patient selection was great, you never know what the patient's gonna do at home, or you never know how the skin's gonna react. So with microneedling, my results are predictable because I have never gotten any post-inflammatory hyperpigmentation from a microneedling procedure. And sometimes the end result is that we want to injure the skin, and the skin needs to repair itself. So it's different ways to skin the cat. So laser technology is great, and I love it. But this is another way to introduce a controlled injury that we know that works, that will allow the patient achieve results, clinical results, with very little complication. So that's why I love it.
Okay, thank you very much. And there was a question for you. What are your most favorite products in
Oh, the line?
huh?
Oh, the whole line? Because I mean, I've been using a lot. It's my favorite line. And I tell you why, and I mentioned earlier, I have never, to me, I'm a product junkie. I do have a big retail space here in Florida. I mean, it's like Sephora. I can get anything I want. And I like to feel things. And I like products that are cosmetically elegant. Every patient likes something that's cosmetically elegant. Nobody wants to use anything that feels yucky. It just doesn't feel good, or it doesn't smell good. But I have never, ever experienced, and I think maybe this is the reason they created it this way, the mesoglide, because as Gabriela showed, gliding that microneedling device is very, very important as to how many of the needles are going to penetrate at the same time at the right depth. If you have a lot of friction with a microneedling device, you're going to tear the skin, right? So microneedling with this device more stamping, but you can actually glide it because the mechanics of the machine itself, the handpiece and the tip, but that mesoglide makes a world of difference. So for me to put one pump of the halide fuse or the antioxidant cocktail and go from my head all the way down to my chest, neck, and both hands, that's unheard of. So I'm using a product that is very cost effective, and it has all these amazing bioactive ingredients that will penetrate deep into my dermis. So I feel that I'm getting a lot of use for the money that I will pay. And I think my patients will agree with me that you don't only worry about the skin on your face, you worry about the skin on your neck, your chest, and everywhere else. So I think it's cost effective, and it has an amazing science behind it. So my favorite product is halide fuse, the cocktail, and the eye cream, if you wanted to know.
Okay, thank you very much. And what is your patient satisfactions from the Dermapen treatment?
Everybody's satisfied. I mean, because everybody sees results. So it's not something like you do it, maybe you see it, maybe you don't. Now, sometimes with other than the CO2, sometimes when you do these non-ablative facial rejuvenation treatments, sometimes you don't see much. And you need multiple treatments before you see something. I mean, you have to really, really aggressive to see something. So with the microneedling, it's not an aggressive treatment per se. I mean, you can make it aggressive if you want, but you can customize the downtime and the level of aggressiveness that you want to do. But even in the most aggressive settings, the patient tend to heal really fast and everybody sees results. I haven't gotten a patient that says, I hate it, I don't see anything. Everyone is satisfied. So satisfaction is really, really high.
Okay, thank you very much. And Per, obviously you are having a big facilities that over there you're doing a lot of surgeries and obviously non-surgical procedures. But on top of this also you have many walk-in clinics only for the non-surgical. Nowadays, that as you said in the beginning of your presentation, that it's so relevant with all what's going on, and that slowly, all over the world, starting to get back, you know, from the shutdown. Some countries earlier, some countries later, but during May, many of the countries are getting back. How do you see from your experience and your numbers the part of the non-surgical versus to the surgical, and obviously a treatment such as, because also you're doing a lot of non-surgical, many different procedures, but as I know from the numbers of your big clinics, that dermapen treatment is pretty dominant. So how do you see this, and how can you share, you know, your experience in regards to that, also economic-wise, with your colleagues?
Yeah, I mean, as I mentioned in the beginning, the COVID-19 situation is difficult, I think, all over the world for most physicians. And we could speak at length about that because it is also something that I think authorities regard as non-essential treatments. You should not sort of do that during these circumstances. And in spite of that, we know that it's really important for the quality of life for patients in the way that they perceive themselves and how they feel. And there's a lot of feedback on how we see ourselves in the mirror and how we actually behave as human beings and how we rejuvenate and become older. So I think the need for aesthetic treatment and the benefits of the aesthetic treatment is much larger than what I think authorities and the general public sometimes understand. And we who are aesthetic physicians understand it very well. But what we've seen during this pandemic, and as I said, in Sweden, we have been fortunate and an outlier compared to many other countries that we have been able to go on with what we're doing, but we have done it with great restrictions, mostly voluntary, where we've said that we won't do certain things because we don't want to put patient into risk. But the non-surgical procedures, I think, can be done very safely. And obviously we take precautions there also, but they don't have to be draconic as some of the measurements that are discussed. We know, as I said in my small presentation relating to this, is that we know that hand hygiene and social distancing is really the only thing that's scientifically extremely well documented. But with that, I think we can go on and do minor treatments. And the interesting thing for us during this period of lockdown that we've seen in many parts of the world, where we have been able to still work, but under certain restrictions, mostly voluntary, we have kept much of the non-surgical activities. Patients has come and the demand has been there. We have done some restrictions and there has been a reduction in what we have done, but it's interesting to see that the number has been basically up to 80% kept revenues in Sweden, whereas surgery has gone down more like 40% or close to 40%. So much more reduction in surgery. And obviously one treatment like Dermapen, it's a very simple and safe treatment. We obviously use facial masks and a shield when we treat patients, and gloves and all of that we always should be used. But I don't think we should institute much more draconic measures than we know is effective. And I think we want to do the things that can keep us doing what we do. I mean, not instituting measures that are impossible to keep on for a long time. Obviously, we have to be careful, but I think it's important to realize that but with normal routines and carefulness, we can keep on doing a lot of what we do. And I think one of the things that are very safe and simple to do is Dermapen treatment. And as I said, we kept a lot of our non-surgical activities during these difficult times.
Thank you very, very much. So now I would like to thank very much all of our presenters, Per, Gabi, Chino, for fantastic presentations and for sharing with us your expertise and knowledge, and for all the attendees, for each and every one of you. Thank you so much for joining us today, watching our webinars. And for further information, please don't hesitate to contact your local distributors or Dermapen World, and also, as I said, for the special offering for the dermaceuticals that Chino presented. So I wish you all stay safe, that we all get back to normalities very soon, and we'll be able to party, hugs, and kiss again soon. And bye for now, and thank you very much, and have a lovely day, night, whatever it is in the world. Goodbye.
Thank you so much.
Thank you so much. Ciao.